marrow is throughout the skeletal system, right? And as you grow older, it is concentrated in the middle part, the axial part of your skeleton, as we grow older. So this is where the development, generation, and regeneration of your blood cells occur. Alright, so um, your cells have to renew. After some time, wear and tear, they will die and they will be replaced. Okay, now so it's a system that works like clockwork. Okay, dia tak payah disuruh. Alright. So this is the whole. I mean, this is the diagram that you can get from your textbook. Okay, so don't worry too much about me, but it's just showing that from one progenitor cell, okay, depending on um, what program, what program it is designed with, will then develop into all the cells that you need in the hematopoietic system. Alright, so now you know that all your hematopoietic cells come from the where? Come from bone marrow. Comes from bone marrow, right? And what you see, okay, in the blood, what you see in the blood is all the end product. Okay, so this is the end product that you are more familiar with. Okay, that doctors will be more familiar with. Okay, this part all happens in the bone marrow. I think I have a picture that can explain this better. Okay, so these are some of the terminology that you would want to get used to, right? So we have a blood stem cell, right? And this blood stem cell, depending on what the program is, okay, what is engraved in its genetics, okay, it can follow a myeloid stem cell line or a lymphoid stem cell line of proliferation and differentiation. Okay, so if you are destined to be a lymphoid, you follow a lymphoid program. Okay, you follow a lymphoid program. Right, so how does this occur? Wallahu alam. Wallahu alam. Really, wallahu alam. Okay, but science is moving forward in a way that, kenapa dia ni? Dia ada timer ke? Maybe I forgot to the timer. Okay, so scientists have actually moving forward in kind of like, not really moving forward, but actually discovering backwards on trying to re-engineer, trying to understand how to manipulate this stem cell and order it. I want a lymphoid program. I want a myeloid program. I want this stem cell to form a blood vessel. Okay, so we are going that way, right? Very interesting times and you all are living in. Okay, so if you are destined to be a lymphocyte, you will follow a lymphoid program. Okay, if you are destined to be any of these cells, a red blood cell, platelet, or any of the granulocytes, you will follow a myeloid program, and there are several myeloid programs. Sama juga lah dengan your lymphoid, very specific programs. Okay, and with those programs, there are a lot of growth factors that come into play. Right, so the more popular or known ones, the ones that we actually manipulate in the clinical setting is, have you heard of EPO? Yes, what is EPO?
Erythropoietin.
Erythropoietin. Okay, how about TPO? Thrombopoietin. Okay, so all of these are factors that are important to direct or mediate the different programs. And GCSF, anyone? Granulocyte colony stimulating factor. Okay, so this also is a growth factor that mediates or helps along the myeloid program to form granulocytes. Okay. Okay, so this is what the bone marrow environment looks like. Okay. Any idea how we take a bone marrow sample? How we got the sample? Any idea? Ambil dari mana?
Daripada bulu.
Agak-agak you all. Cucuk. Ha? Tengok dia.
Belakang
Cucuk apa?
tu
Kena cucuk?
lam.
Ini panggil ni kena cucuk punggung. One of the thickest. Okay, one of the thickest would be apa? Your dekat pelvic bone tu lah. Kan? This is the usual site is apa? Posterior superior iliac spine. Okay, to get this sample. But mind you, children, okay, there are other areas. Tibia pun boleh, sternum pun boleh, in order to get a marrow sample. Okay, so this is an example of a marrow environment. Alright, so you've seen what your gut lining looks like, what your pancreas looks like, what your heart looks like. Alright, so those are all quite boring compared to bone marrow. Alright, because in those organs, boring in the sense that you see the same thing. Kalau heart, what cells do you see?
Myocyte.
Apa cell dia?
Myocyte.
Basically apa?
Myocyte.
They are apa? Skeletal type cells kan. Myocardium tu is apa? Muscle kan. Is muscle. Is muscle. Alright. If you are looking at your gut lining, your stomach, what do you see?
Epithelial.
Cells apa? Tall, columnar, with or without apa?
Cilia.
With or without?
Cilia.
Cilia lagi apa? Kalau jauh sikit dalam gut dia ada apa? Yang menghasilkan mucus tu.
Goblet
Goblet cell. Okay, but you see kind of like the same thing. Okay, but in the bone marrow, this is what you see. Okay, nampak merah-merah dot-dot on dia. Nampak sama je semua, but no, they all are different types of cells. Okay, so this is what okay, so if we took one area and we blew up this one area, what would you see? So you would see a mixture of fat spaces. Okay, so these are fat spaces, right? And in between those fat spaces are the hemopoietic areas, the areas where your hemopoietic cells grow and flourish and develop. Right? So there's a blood vessels, ada blood vessel kat sini. Alright, so the largest or the more noticeable would be your megakaryocytes. So megakaryocytes are the precursors for platelets. Untuk mendapatkan platelets. Okay, what are platelets? Apa nama lain platelets? Thrombocytes. Those really funny looking cells, not really cells, they are just apa? Fragments of the cytoplasm. Tu je. Ada nukleus tak? Platelet. Siapa kata ada, angkat tangan. Balik buka pintu tengok platelet rupa dia macam mana. Okay, so platelets are just apa? Budding of the cytoplasm of the mature megakaryocytes. Okay, and then you have je lah cakap red cells. Okay, so this is another blown up image, more than 100 times again. So these are all your erythroid islands. So you have erythroid islands. Okay, and you can have all kinds of activities. You can have phagocytosis in the bone marrow. Okay, and you can have nursing cells. Nursing meaning apa? They are feeding. They are feeding the erythroid colonies here. Okay, so you can also have an abundance of granulocytes. So, but what you see in the blood is not as what is depicted in your bone marrow. Bone marrow tu dia nampak apa? Nampak sibuk, nampak ni because apa? It is the place for proliferation, for development, kilang. So busy sikit. But what reaches us is apa? Is already the final product. Okay, yang red cells, platelets, or your different white cells. Okay, right. So in the bone marrow, okay, this is your bone marrow. What you would expect to see would be your stem cells right up to your kind of like your uh, precursor cells. Precursor cells, kalau neutrophils are up to band form. Right? If you are megakaryocytes, then megakaryocytes, and then you have your if it was red cells up to the nucleated red cells before all of these are released into the circulation. Okay, so do you expect to see all these progenitor cells, the intermediate developing cells, promyelocytes, immature eosinophils, immature anything? Would you expect to see this in the peripheral blood? Yes or no? No. Okay, would you expect to see them in the peripheral blood? No. In the peripheral blood, you expect to see the final product. Itu sahaja. Undergraduate, tolong terus imprint benda tu. You are expected to see the final product. The moment you see all this or any of this in the peripheral blood, there's something wrong. That something wrong could be a neoplasm. It could be a reactive process. Okay, but definitely something is going on. Right, so that's our job to find out. Okay, so from all my, I don't usually put a lot of slides. Paling banyak dalam 30. Okay, but the most important is actually this one. Yang lain tu nak baca sunat. Yang ni wajib. Alright. Okay, so this is what you need to carry forward until you bukan professional saja, until you graduate lah. Okay, you will not get a lot of hematology exposure. I think probably this is the time lah where you get a bit more. Alright, so this is the most important slide that you need to remember. Alright, so go back and do your own. If you don't like my color scheme, you can do your own. Right, but this is the most important when we are discussing malignancies in the hematopoietic system. Okay, so leukemia is a heterogeneous group of neoplastic proliferation of white cells. Okay, in general, this is what this is the definition of leukemia. Okay, so when we are discussing leukemia, it is important to understand lineage. Exactly what we have been talking about for the past 10-15 minutes lah, lineage. Okay, whether you follow a lymphoid line or a myeloid line. Lymphoid program or a myeloid program. That is what lineage means. Okay, lineage. Okay, whether you are a lymphoid or a myeloid. Okay, get me? Alright? Okay, so if you are a lymphoid, you have another two programs. Either you are a B cell or a T cell. Okay, tapi nampak petak-petak ni dah nampak the solid lines. So the solid lines means that it is more prominent. Okay, your B cells are more prominent, while your T cells are less prominent. Less prominent, less common. Okay, so then we go into the different types. If we straight away go into types, it would be a bit of a muddled. Tiba-tiba macam alamak dia duduk dekat mana, how you want to place them. Okay, so now you can actually place them. Okay, so types. So you have acute leukemia. Okay, and if you are a lymphoid lineage, it is called acute lymphoblastic leukemia or ALL. Okay. Okay, so if another form of acute leukemia, if you are following a myeloid program, then it is a acute myeloid leukemia. Okay. So we will go through what all of this means. Okay, but just going through the terminology. If you are a chronic type of leukemia, tengok leukemia neoplasm pun boleh ada perkataan chronic. Okay. So chronic, if you are a lymphoid line or lymphoid lineage, a lymphoid program, you are a chronic lymphocytic leukemia. This is for undergraduate. Okay, the subclassification is very complex. Okay, so this is what you need to. You can go back and read, open up WHO, which is our kind of like the Bible for placing or subtyping. But this is just to keep you grounded dan boleh faham. Okay, and myeloid, if you are a chronic type, you are a chronic myeloid leukemia, ataupun the bahasa dia is apa, myeloproliferative neoplasms. Okay, but we will only go in, there are a few types, but we will only go into chronic myeloid leukemia. Okay, so the reason why we have all this classification, different types, we understand lineage, is because the treatment for each type is different. Itu penting dia. Treatment is different. You give the wrong treatment, you diagnose wrongly, patient die. Okay, patients die. Right? So that's why it's very important. Okay, so the site of involvement for all is basically the bone marrow. Okay, so when it takes over, so it's a neoplasm, kan? Neoplasm is a malignancy. It takes over that tissue, that organ. Okay, so this is the equivalent to solid organs juga lah. So it takes over the bone marrow, alright, and it spills into the peripheral blood. Okay, boleh nampak macam mana this neoplasm gets into the blood, hence it becomes a hematosubject. Okay, alright. Okay, so there would be two types of malignancies actually by effect in hematology. So what we are discussing today is leukemia. Okay, there is also another entity called lymphoma. Okay, have you ever had a relative diagnosed with lymphoma? Ada. Okay, so it is part and parcel of hematopoietic disease, but a lymphoma just means that the neoplastic cells, the proliferation of the neoplastic cells were found primarily in these tissues, either lymph nodes, spleen, okay, or it could be extramedullary also, but usually all your secondary lymphoid organs or your lymph nodes. Okay, so it doesn't mean that this cannot spill into the blood. Boleh je, kan? Because your lymph nodes are all kind of like interconnected, alright? You will have lymphocytes inside your bone marrow and whatnot. Okay, so you might get confused with leukemia. But for undergraduates, suffice for you to know that lymphoma means it's more of a tissue disease. It's a tissue disease. Okay, so So Dr. Alina will discuss lymphoma with you. You will hear the same thing. Is it B cell? Is it T cell? Lineage, typing. Okay. But essentially it comes from tissue. So leukemia is basically involvement of the bone marrow, right? Spill into the peripheral blood. Okay, so let's look at some of the etiology and pathogenetic factors. This is the most boring slide, the newest slide. That usually, even in your textbook also, you will kind of like skip this part. Okay, tapi kena faham sikit lah. You have to understand a little bit. Okay, so how does it occur? Kan? How? Asal-asal sihat, tiba-tiba sakit. Betul tak? Dia macam tu lah, tiba-tiba je tu. Macam tu. Right? So, the most common would be the acquisition of chromosomal translocations and acquired mutations. Okay? So, these all happens apa? Tiba-tiba lah. Dia tak clear of that. Okay? One time you were healthy, the next day you have a leukemia. Okay? So, this is the most common. Right? So, you've heard about oncoproteins, you've heard about proto-oncogenes. Okay, so there are oncoproteins that develop that arrest cell differentiation. Faham tak? Maksudnya apa? Maksudnya sel tu dia tidak apa? Dia tak in a cell has to differentiate, betul? Bila dia differentiate, dia gain apa? Dia gain function, purpose. Why am I here? What is my purpose? Kan? If you are a cell in the gut, then your purpose is to be apa? Is to be a part of the gut. Betul tak? So you have to function as a cell in the gut. Gitulah. So if you are in the bone marrow, so you are expected to follow any of these lineages. Kerjaya dia banyak sikit kita dekat sini. Okay, so you cannot forever be immature. Ni dah jadi philosophical sikit kan. Cannot be immature. You have to differentiate. Okay? And the ones who differentiate actually will gain more lah. Will gain more. Okay? Philosophy. Okay? Right. Okay, so going back. Okay? So proto-oncogene activation or its dysregulation and are also as a result of some of these chromosomal translocation and acquired mutation. So we will go through one or two sahaja. Okay? Right. So leukemias can be associated with some inherited genetic factors. Okay? So this is more. Okay, so this is more hereditary. Okay, they have an inherent hereditary abnormality, which induces other abnormalities genetically. Genetically unstable or more susceptible to some other genetic changes. Okay, so these are some of the diseases that are associated. Okay, right? Okay, then the next would be some viruses. Okay, so these viruses, HDLV1, EBV or Epstein-Barr, Kaposi, sarcoma herpes virus. Okay, they are implicated mainly in lymphomas. Okay, it's just that sometimes, the lymphoma they spill into the blood. Okay, they spill into the blood. Dapat kat I nampak dulu dia punya peripheral blood dia penuh dengan those tumor cells. Okay, so that's why kadang-kadang di subtyping tu dia jadi leukemia / lymphoma. Kita pun tak sure yang mana datang dulu. Lebih kurang gitulah. Okay, but as you mature, you will understand why. It's just that for this age, I'm not trying to patronize you, but so that you don't jangan obses untuk macam mana nak pastikan yang ini lymphoma leukemia. No. Okay, for undergraduate, it's not important for you to understand that yet. Okay, interested to read, you are more than welcome to explore that, but it is not a must. Okay, suffice for you to know that this does happen. Okay, alright, so ambil injection, terus dapat ni injection. Lain tau ni. Injection tu masuk ambil darah kan. Nanti nak terang kat patient. Okay. Right, okay. So these are called lymphotrophic viruses. Okay, viruses yang cakna kepada that cakna betul kan? Cakna, they like they are dear to lymphocytes. Okay, and how are they implicated in malignancy? Okay, they have oncogenic potential. Okay, so viruses, how do they keep alive? Viruses, how? Coronavirus, how did it keep alive? Viruses in general lah, they have to
Have a host.
Apa dia? Tak dengar dia. Host, yes. They have to infect the host and use whatever the host has. Okay, so this is exactly what happens. The viral gene products, okay, that infect the host interact, okay, with the host transcriptomics or transcription factors in the cell, and this mediates cellular transformation, hence oncogenic ataupun mediates oncogenesis. Okay, faham? Right. Okay, and there's some infections or chronic immune stimulations causing chronic immune stimulations, such as Helicobacter pylori, okay, which is associated with gastric B-cell lymphomas. Alright, AIDS infection, HIV infection, or gluten-sensitive enteropathies are associated with intestinal T-cell lymphomas. So this is quite special when if you treat the infection, the lymphoma is cured. Right? Okay, iatrogenic factors, okay, such as the mutagenic effects of ionizing radiation, chemotherapy, drugs, all can mess up with the genetics, causes genetic aberrations. Okay, and of course smoking, all the carcinogens in smoking is a cause for cancer in almost all types of organs. Okay, so let's go to one arm. Let's go to your lymphoid arm. Okay, so leukemia, right, involving the lymphoid arm. Okay, remember, B cell is more prominent, okay, is more common, okay, compared to your T cell. Alright, so NK cell is another form of T cell. Lagi, patutnya buat kecil lagi sebenarnya because it's much rarer. Okay, right, so we have two types, okay, not really two types, but the ones that you need to know. Okay, acute lymphoblastic leukemia and chronic lymphoblastic leukemia. So what are the difference? Okay, the difference is in acute lymphoblastic leukemia, the cells are immature. Okay, your neoplastic cells are immature cells, really immature cells, right? And for your chronic lymphocytic leukemia, your cells are mainly, the neoplastic cells are mainly made out of mature cells. Cells tu nampak like you and me, normal aja kan, macam other lymphocytes, but they are genetically abnormal. So they are abnormal, mature abnormal lymphoid cells. Okay, boleh? Right. So, acute lymphoblastic leukemia is a proliferation of a clone of immature blood cells. So, it's derived from, ingat lagi, that mutant stem cell. Okay. Tak tahu ni, tak tahu ni. Kita ingat. Okay, so from your stem cell. It could be from here, it could be from here, it could be from here. Okay, if the leukemia was of this type, okay, which we have identified, it's about worse prognosis. Okay, but suffice for you to know that this is the cell that becomes malignant in acute leukemia. Okay, so those the neoplasm will be composed of immature B cells or immature T cells, or referred to as lymphoblasts. Okay, so this is what the morphology would look like. So we will do a bit more revision in your practical also to remind you what you expect to see in the peripheral blood. Semua ni dalam darah. Ini sahaja dalam marrow atau tissue. Okay, so this is in the blood. Okay, so these are your yes. So do they look like neutrophils? Neutrophils ada apa? How would you identify neutrophils? Dia ada apa?
Loop.
Dia ada apa?
Loop.
Lobes, yes, kan? On apa the usual description is apa? Macam cuping telinga kan? Ada cuping telinga sini? Ada. Kan? So kalau susah sangat nak bayangkan apa? If you go to nursery tempat baby baru lahir, kan ikutlah ada kakak ke abang ipar ke kan baru salin. Okay, you see the babies. Can you tell which one anak saudara aku yang mana? Kenapa? Boleh tahu tak yang mana lelaki mana perempuan? Boleh tahu tak? Tak kan? Why?
Sama je.
Sebab apa?
Immature.
There are no distinct features. Betul tak? To say that this is my nephew, this is boy, this is girl, kan? Unless you see other things. Okay, but on its face, they look apa? The same. Itulah dia. Okay, they look the same. Okay, so the lymphoblasts in the marrow or peripheral blood would have this description. Okay, high nuclear to cytoplasmic ratio. Nuclear besar, cytoplasm sikit. Nucleus besar, cytoplasm sikit. Scant cytoplasm. And inconspicuous, look, ini sepatutnya nucleoli. Okay, so you have a nucleus, and in the nucleus you have apa? If they are immature, they have a nucleoli. It's the brain of the nucleus. Okay, bila dia kecil you boleh nampak. Bila dia immature, you can see. Okay, but in this type of neoplasm, usually tak nampak. Inconspicuous. Inconspicuous maksud dia apa? Not apparent. Not apparent. Right? So the marrow will be filled with these type of cells. With these neoplastic cells. Your marrow will be hypercellular, no fat spaces, and filled with the brain cells. Okay. Right, so a little bit about acute lymphoblastic leukemia. It is the most common cancer in children. Okay, about 85% are B ALLs and less commonly T ALLs. It doesn't mean that it doesn't happen in adults. It does. It does happen in adults. And with aggressive chemotherapy, then 95% of children with ALL can be cured. Ambil injection ke? Injection? Injection. Okay. Alright, they can obtain complete remission, meaning they are free from the disease, and up to 85% are cured. Okay, but this is not so for adults. Very different from adults. Tak sama. Even though it's the same entity, but it is very different. Okay, right. So, what are the associated clinical features that you see? Okay, so the symptoms that you see are a direct result of depression of normal bone marrow function. Okay, so semua orang sekarang dah terror, dah jadi junior hematologist. You know what the bone marrow is supposed to do, betul?
Okay.
So it's supposed to produce all your apa? All your end product, blood cells, red blood cells. So you know what red blood cells are for? Untuk apa?
Body oxygen.
For yes, to carry oxygen. So when you don't have enough, you get anemia, okay? You get fatigue, weakness, malaise, macam lah, okay? Neutrophils, lymphocytes and whatnot, they are used to apa? Untuk apa? They are used for to fight off pathogens and infections. Okay, so when you don't have enough, you're prone to infections. Okay, platelets. What are platelets for? To
Blood
form a
clot.
blood clot. Okay, so this is another headache in hematology, but we will go through this next week. Okay, so if you don't have enough, you don't have a good plug, you tend to bleed easily. Okay, so depression of marrow function. Okay, so a few more which is a bit more specific for acute leukemias, acute lymphoblastic leukemias to be specific, is a mass effect. Okay, mass effect where there's marrow expansion and periosteum infiltration. Your bone marrow is apa? Is expanded. Nampak tadi? Very hypercellular kan? It's filled to the brim. Macam nak pecah. Kan? It's just that your bone is keeping it together. Okay, so patients may feel bone pain. They can have organomegaly, generalized lymphadenopathy, splenomegaly, and in children, testicular enlargement. Okay, and if it was a T cell type, this would be associated with mediastinal mass. Okay, a mediastinal widening or enlargement, which compresses your airway, causes large vessel compression. Okay, and it can even go up to the brain, causing meningeal irritation. Meningeal irritation with CNS symptoms being headache, vomiting, and if it's worse, it can cause some nerve pulses. Okay, so what is the prognosis for acute lymphoblastic leukemia? Right, so there are good prognostic favorable or good prognostic factors, and there are bad or worse prognostic factors. Okay, so these prognostic factors, what do they mean? Factors that make the patient's conditioning more favorable to survival. You bagi ubat yang sama to these two groups, but that group will be more favorable to get that, to achieve that 85% cure and whatnot compared to this group. Right, so these are some of the factors. Okay, you can read. One of them is age. So either you are, if you are too young, okay, it's a worse prognosis. If you have some extra genetic abnormality, also is a bad prognostic factor. You have a high tumor burden. Okay, acute leukemia, acute lymphoblastic leukemia in adolescence or childhood, adolescence or adulthood is also a poor prognostic factor. Okay, right. Next, let's go to, I think we're going to the next one, which is your chronic. Okay, so tadi kita dah habis immature acute lymphoblastic dah. Okay, now we are going to chronic. So chronic lymphocytic leukemia is mainly made out of mature cells. You and me, they are mature, but they are abnormal. Okay, so this is what it would look like. So this is what I mean by the cross between lymphoma and leukemia. Okay, alright. So in the peripheral blood, okay, this is what you would see. Mature small lymphocytes. Kalau tengok sorang-sorang dia nampak macam apa? Nampak macam lymphocyte lah. How do you know they are lymphocytes? They are round, mononuclear, one nucleus, and the nucleus looks apa? mature. How do you know it looks mature? It looks apa? Dense or clumped. Okay, compare balik, tengok balik. Baby, ingat baby, smooth. Okay, smooth, kan? Smooth, open, lembut aja. Betul tak? Nampak lembut tak? Lembut aja. Lembut. Compare to this one, nampak apa? Nampak macam ketak-ketak gitu. Dah wrinkly, Okay, but these are condensations. Dense chromatin pattern. Okay, dense chromosome pattern. Okay, right. So you have a lot of these. Okay, banyak. Okay, so that's the hallmark of neoplasm. Kan, you have more than what you need. Kan? Okay. Right, so this is what it looks in the peripheral blood, and this is if, because they are lymphoid, they have residency also. Dia punya apa, tempat, dia punya rumah dia. Also, they can reside in the lymphoid organs, kan, or secondary lymphoid organs. Okay, so this is in the lymph node. Ini semua tumor cells. Okay, these are all tumor cells. I mean, Dr. Alina will go through a bit of lymphoid morphology with you lah, okay, lymph node morphology with you. But this is what it looks like. Okay, so if you're talking about chronic lymphocytic leukemia, they are mature small lymphocytes. Keluar exam, this is what we want you to write. Plus minus smudge cells. Tapi for undergraduate, kalau you dah tahu benda tu CLL, nampak tak nampak you tulis. Nampak tak nampak you tulis. Nak pass exam kan? Nampak tak nampak you tulis. Okay, but this is what it looks like. Smudge cells. Okay, so for CLL, okay, so they are mature lymphocytes. Okay, in your books, they may be classified under lymphoproliferative. Okay, lymphocytes that are proliferative. Okay, tumor. Okay, right. So it is the most common leukemia of adults in the Western world, with a median age of around 60. Okay, and the male predominance. Okay, so in some books you will see apa? CLL stroke SLL. Siapa yang baca buku lah. Okay, CLL stroke CLL. So CLL apa? Chronic lymphocytic leukemia. SLL, small lymphocytic leukemia. Okay, what does it mean? It just means the cells, the tumor cells, those small mature cells, kita jumpa dulu dekat mana? They were found in the lymph node dulu. Jumpa kat lymph node dulu. Buat biopsi, jumpa kat situ dulu. Okay, compared to a presentation in the blood, which is CLL. Okay, right? Tissue, SLL. Blood, bone marrow, CLL. Aku salah sebut tadi. SLL, sorry. SLL in the lymph node. CLL, bone marrow and blood. Okay, but basically the same cell. Okay. So again, this is because of some genetic aberrations. So ingat lagi the pathogenesis dia. Yang pertama, okay, the main possibility is apa? Is a chromosome aberration, a chromosome translocation, genetic aberration. You acquire it like that. Okay, so you acquire it just like that. So the most common mutations are chromosomal deletions associated with CLL. Okay, and chromosomal translocations doesn't mean it doesn't happen, but it's rare. That's why the box is small. Okay, so chromosomal deletions are more common because there must be some event that causes it to become abnormal. Betul. So this is mainly genetics, molecular genetics, chromosomal aberrations, to kind of like kickstart, okay, the problem in the programming, causing it to become neoplastic. Okay, so patients, ingat ini penyakit atuk-atuk, CLL, penyakit atuk-atuk. You never diagnose CLL in apa? 3-year-old, 10-year-old, okay, never, okay. I know never say never lah, but but still never. Okay. So patients atau atuk ni are often asymptomatic at diagnosis, and if they are symptomatic, they sound a bit vague. Kan? Semua orang ada atuk kan? Siapa yang ada atuk-atuk, nenek-nenek kan? Semua komplain apa?
Penat.
Sakit. Semua sakit.
Sakit.
Kan? Sakit badan, letih. Okay. So easy fatigability, weight loss, anorexia. Okay. Some may have more pertinent signs. They have some lumps and bumps. Okay. So generalized lymphadenopathy. Or hepatosplenomegaly. Okay, so these are symptoms which are important for you to elicit. Okay, mereka cakap macam tu lah, tak lalu makan, dia dah okey. Okay, tu ada demam tak? Lepas tu tanya lagi pasal demam. Demam tu berapa lama? Demam tu demam naik turun. Oh, is it associated with chills? Okay, are there night sweats? These are all the associated signs and symptoms. And bila dia kata rasa macam dah kurus, tak lalu makan. Okay, so as a doctor, you have to be a bit more objective with your assessment. Okay, so the loss of body weight is about more than 10% over 6 months. So kena kira lah, buat sedikit calculation dekat situ. Tahu agak-agak dia punya baseline. Okay, and then do a little bit of calculation whether it is 10% less. Okay, right. So the leukocyte count meaning the white cell count is usually apa? Very high. Okay, usually very high, and this may indicate heavy tumor burden. Okay, right. So they may come to you not with this, but actually already with complications already. Okay, so they come to you already with apa? With frequent bouts of infections. They may come to you with anemia, and then bila tengok ada some lab report kata evidence of hemolytic anemia. Okay, and thrombocytopenia. Okay, right. Okay, so dah habis about your lymphoid. So we are going to the other arm. Okay, myeloid pula. Ni nak compress ni 4 tahun I mengaji, compress in 1 year ni. Okay, 1 hour. Okay, so myeloid sama saja. Jangan panik, sama saja. Acute myeloid leukemia, what are the cells? What are the tumor cells? Immature blast. Okay, immature blast, babies, baby cells. Okay, and then you have the chronic myeloid leukemia. So they are actually clumped under myeloproliferative neoplasms. And if you perasan in your lecture, in your program, we have another lecture to address myeloproliferative neoplasms. It's just that chronic myeloid leukemia is the only neoplasm in this class yang actually ada perkataan leukemia. Okay, so that's why kita lump dia dekat sini, so that you can kind of like make that whole comparison. Okay, so too much proliferation, these are all immature blasts, and then in between there's actually what we call myelodysplastic syndrome. Baca tak SLP? SLP? SLP dah kan? Dah. Ada tak? Myelodysplastic syndrome, tak